All right, great. We're going to go ahead and get started. Welcome everybody to our Rush Generations lecture on flu, virus, and respiratory health. I'm Jasmine Chandy. I'm a program coordinator for Rush Generations. And so thank you so much for finding your way here, whether you've joined in on the phone or if you've joined in on YouTube. We're glad you're here. For those of you who might be new to Rush Generations, welcome. Rush Generations is a free health and wellness program that's all about aging as best as we can. So we offer a number of great programs that help meet that goal. One of those is these bi-monthly lectures. So we have at least 2 every month. We also have workshops, exercise classes, support groups, tons of great opportunities for you to get involved. So at the end of this lecture, we will be sharing some of our upcoming programs so you can get updated on that as well. So just a couple of rules as we get started. So throughout the lecture, you're welcome to ask any questions or any comments in the chat. So if you've joined in on your computer or your tablet, you'll see a live chat button at the bottom or the right side of your screen. You can just click that and type away throughout the lecture, and we'll go ahead and share that with our speaker at the end. For those of you who've joined in over the phone, you will have the opportunity to unmute yourself and ask a question at the end of the lecture. So definitely do add any comments or any questions to make this experience a little more rich and so we can interact with our speaker. All right, so without further ado, we're going to go ahead and introduce our speaker for today. So we have here from the Respiratory Health Association, which is a public health nonprofit specializing in lung health. Its mission is to provide healthy lungs and clean air for all through research, educational programming, and policy change. Really important, a great association, and especially important right now. And so through the Respiratory Health Association, we have Avanti Chaturthi, who is a senior program coordinator with Respiratory Health Association. She currently coordinates programming of the Respiratory Health Association COPD management and tobacco cessation programs. She holds a master's degree in public health, specializing in community-oriented primary care. So we're really happy to have you here today. Welcome, and we'll go ahead and get started.
All right, thanks, Jasmine. I'm going to just share my screen. Okay, and so thank you all for having me today. I will be focusing on flu and other respiratory viruses, respiratory diseases in general, and then how best you can protect yourself. So like Jasmine said, my name is Avanti Chaturthi, and I'm a senior program coordinator at Respiratory Health Association. And I coordinate programs for tobacco cessation and COPD management. So this is just a brief agenda for today. So first, I'll give an overview of common respiratory diseases, and then we'll move into talking about the flu and other respiratory viruses, who is most susceptible to getting those viruses, and how you can protect yourself from them. Then we will spend some time going over some evidence-based ways that you can protect yourself. And then finally, I'll give you an overview of the resources that we have at Respiratory Health Association that you can use to help. So yeah. And just a little bit more brief background on Respiratory Health Association. So our mission is to prevent lung disease, promote clean air, and help people live better through education, research, and policy change. We have been a public health leader since 1906, when our organization was first established to address tuberculosis. So as the nature of respiratory health diseases evolved, so did our focus as well. So today we address asthma, chronic obstructive pulmonary disease, also known as COPD, lung cancer, tobacco control, and air quality initiatives. We're located in West Loop, but our programming serves Chicago, Illinois, and we're expanding nationally. So first, we'll review the common respiratory diseases. First, we'll look at asthma. So asthma affects 18 million adults and nearly 6.2 million children. asthma inflames and narrows the airways, which can make it difficult to breathe. It is the common symptoms for asthma include wheezing, coughing, and chest tightness. It can be controlled with trigger avoidance and proper medication usage, but it's still a serious and potentially life-threatening disease. And you can't outgrow asthma. So if you had asthma in the past, you will always have it, but it might just be well managed if you're not experiencing symptoms right now. So that may be why it may seem like it's gone away, but asthma is a chronic respiratory disease. So it's something that if you were diagnosed with it in the past, you will always have it for the rest of your life. So next we'll look at chronic obstructive pulmonary disease, which is also known as COPD. There are 16 million US adults that are diagnosed with it, and many more may still have it, but don't know it. It is the fourth leading cause of death. And it's a group of lung diseases that includes emphysema and chronic bronchitis. So emphysema, what happens with that is that the walls between the air sacs in your lungs become damaged. And chronic bronchitis means that the lining of the airways are constantly inflamed, which causes thick mucus to form. So this causes symptoms such as shortness of breath, mucus in the lungs, and coughing. Some of the most common causes of COPD are smoking, and then other causes can include secondhand smoke, indoor air pollution, chemicals, and dust. There's also a rare genetic disorder that can cause COPD called alpha-1 antitrypsin deficiency. So next we'll talk about lung cancer. There are two main types of lung cancer: non-small cell lung cancer, which this spreads more slowly, and in the first stage it is only in the lungs, or it's only in a little part of your lung. And then small cell lung cancer, which spreads more quickly, and in the first stage it's on one side of the chest. 85% of lung cancer in the United States is non-small cell lung cancer. And lung cancer is the leading cause of death from cancer and the third most common cancer in men and women. Common signs and symptoms include a cough that won't go away, coughing up blood, chest, back, or shoulder pain, shortness of breath, wheezing, hoarseness, being tired, and weight loss. More than half of lung cancers are diagnosed when the disease has spread. However, it's been shown that when lung cancer is caught early, so when it's only caught in one site, the 5-year survival rate increases. So it's really important to get screened early for lung cancer if you're experiencing some of these symptoms. The other reasons to get screened for lung cancer, lung cancer screening should start if you are 50 years old. And for those who have a 20-pack year tobacco history. So that means if you smoke a pack per day for, if you have smoked a pack per day for over 20 years or 20 years or above, you should get screened for lung cancer so it could get caught in the early stages. So next we'll talk about pneumonia. So pneumonia is an infection that causes air sacs in the lungs to fill with pus and other liquid. The people that are most at risk for pneumonia are adults 65 and older, children younger than 2, people with certain medical conditions, and people that smoke. There are more than 30 different causes of pneumonia, which these can be grouped into specific causes. And the most common are bacterial and viral pneumonia, which we will review on the next couple of slides. Bacterial pneumonia is caused by various bacteria, and the most common is Streptococcus pneumoniae. It occurs when the body is weakened in some way, such as by an illness, poor nutrition, old age, impaired immunity, and when you are infected, the bacteria are able to work their way into the lungs. It can affect all ages, but you are at greater risk if you abuse alcohol, smoke cigarettes, are debilitated, have recently had surgery, have a respiratory disease or viral infection, or a weakened immune system. There are various symptoms, which include fever, cough, confused mental state, low energy, chest pain, chills, and shortness of breath. There's others, a couple other symptoms as well that are less common but can still happen. So having bluish color to the lips or fingernails, a confused mental state, rapid breathing, rapid pulse, and chest pain. There is a treatment for bacterial pneumonia, and it's typically antibiotics. Viral pneumonia, so this is caused by various viruses, including the flu, and it is responsible for 1/3 of all pneumonia cases. You're actually more likely to get bacterial pneumonia if you have viral pneumonia. The early symptoms are the same as bacterial pneumonia and may be followed by headache, increasing shortness of breath, muscle pain, weakness, and worsening cough. Most viral pneumonias don't have a specific treatment and usually get better on their own. But in general, if you do have viral pneumonia, you should eat well, increase your fluid intake, and get rest. And then if you have severe symptoms or symptoms that are bothering you, sometimes oxygen therapy, pain medication, fever control, and cough relief medicines can help those symptoms. And then in general, to prevent pneumonia, you should make sure that you get your flu shot every year, as flu is a common cause of pneumonia. There's also the pneumococcal vaccine, which can protect you from bacterial pneumonia. So this is recommended for children younger than the age of 5 and adults ages 65 and older. So now we are going to, in the next couple of sections, we'll review respiratory viruses, some of the common symptoms of these viruses, who is most at risk, and who is most at risk if they get these viruses. So we'll first focus on the flu. So the flu is a respiratory illness that is caused by the influenza virus, which infects the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. It spreads through tiny droplets when infected people cough, sneeze, or talk, and can also spread when an infected person touches a surface or object that has the flu, or when a person touches a surface or object that has the flu virus on it, and then touches their own mouth, nose, or possibly their eyes. On average, about 8% of the population gets sick from the flu each season, and this ranges from between 3 to 11% depending on the season. And the flu season generally runs from October to May, but the timing can also vary. Most of the time, the flu activity peaks between December and February. The flu can cause mild to severe illness and at times can lead to death. It is different from a cold. The flu usually comes on more suddenly than the common cold. People who have the flu often feel some or all of these symptoms listed on the side. So this on the slide, which include fever, cough, fatigue or tiredness, headache, muscle aches, and sore throat. People are most contagious in the first 3 to 4 days after their illness begins. And these symptoms can sometimes lead to complications, including bacterial pneumonia, ear infections, sinus infections, and worsening of chronic medical conditions such as congestive heart failure, asthma, diabetes, or COPD. Anyone can get the flu and have serious problems related to the flu, but some people are at higher risk of developing serious flu-related complications if they get sick. So this includes people 65 years and older, people of any age who have certain chronic medical conditions. So this includes asthma, COPD, diabetes, chronic kidney disease, or heart disease, pregnant women, and children younger than 5 years. One thing that is important to note is that during most flu seasons, people 65 years or older bear the greatest burden of severe flu disease. So it's estimated that between 70 to 85% of seasonal flu-related deaths occur in people 65 years or older. and 50 to 70% of seasonal flu-related hospitalizations occur among that age group as well. So the risk is due in part to changes in the immune defenses as you get older. So it is important for everyone to get the flu shot, but especially those that are in these high-risk categories. You may experience mild symptoms from the flu shot, but that's just your body that is developing response to the inactivated or weakened virus. So when vaccinated people are actually exposed to the flu virus, your body can fight it off or reduce its impact, so you only have mild symptoms and you don't have to be hospitalized. So now we'll talk about a couple of other respiratory viruses. So first, we have to talk about COVID-19. I'm sure everybody has heard so much information about this. So I will only do a brief overview of information about this. So we saw that COVID-19 was first identified in 2019, and it's a part of a class of coronaviruses that cause illness in people. So coronaviruses in general are not new. They are common throughout the world, and they typically cause mild to moderate illness. COVID-19 itself is more highly contagious than other strains of coronaviruses, as we've seen. It is commonly spread from close contact with an infected person. So for COVID-19, it appears to occur mainly, or the spread occurs mainly through respiratory transmission. So if somebody is coughing or sneezing, the virus will spread to people around in that area where someone is coughing or sneezing. And as we know, there is a new COVID-19 variant called the Delta variant. It is a variant that originally surfaced in India and was first identified, the first case was identified in December 2020. And the strain is continuing to spread rapidly. Though this variant is more contagious, it doesn't seem to be more severe for people that have been vaccinated. The variant was first detected in the United States in March 2021, and now makes up a majority of the COVID cases in the United States. Breakthrough cases are cases that occur in people who have gotten the vaccine, are uncommon, but they are likely to, they can happen. However, we are seeing that people who do get the virus after getting a vaccine are more likely to have a mild case, like a cold. And in fact, even with the increase of the Delta variant, more than 97% of COVID-related hospitalizations are from people who did not get a vaccine. So most people who get sick with COVID-19 will develop mild to moderate respiratory symptoms. However, people who are more susceptible to infection may develop more severe disease. Some of the most common symptoms include fever, tiredness, dry cough, and difficulty breathing. Some patients may also have aches and pains, runny nose, nasal congestion, sore throat, or diarrhea. Illness can begin 2 to 14 days after an exposure. And if these symptoms sound like influenza, you're totally correct, but the consequences of COVID-19 are potentially more serious, which is why if you do experience these symptoms, you are encouraged to seek medical attention. Most people who are infected with the virus, about 80% recover from the disease without needing special treatment. So who is most at risk for COVID-19? This includes older adults, because more than 80% of the COVID deaths occur in people over the age of 65, and more than 95% of COVID deaths occur in people older than 45. People who have cancer are also more at risk, as cancer treatments can weaken your body's ability to fight off the disease. Having chronic diseases like chronic kidney disease, chronic lung disease, diabetes, heart conditions, liver disease, These can also make you more likely to get severely ill. Those who have dementia or other neurological conditions are also more at risk. Same with people who are overweight or obese, and those who have substance use disorders or are a current or former cigarette smoker. So these people are not more likely to get COVID-19, but they're more likely to experience serious complications if they become infected. So the best thing to do, again, is to protect yourself is get a vaccine, and then think about social distancing and other ways to protect yourself, which we will go over in a later section in today's presentation. Next, we're going to talk about respiratory syncytial virus, are also known as RSV. So this is a respiratory virus that can cause mild cold-like symptoms, and transmission happens through respiratory droplets from coughs or sneezes. This virus can survive on surfaces and can be spread from contact of surfaces that have been that an infected person has touched or sneezed on or coughed on. And hospitalizations may occur from this if the infected person is having trouble breathing or is dehydrated. Some of the common symptoms include running nose, decrease in appetite, fever, cough, wheezing or whistling of the breath, and sneezing. And these symptoms can lead to other serious conditions such as pneumonia, asthma flare-ups, COPD exacerbations, and congestive heart failure. So who's most at risk for RSV? This includes older adults, especially those with underlying heart or lung diseases, and infants. We see about 177,000 older adults that are hospitalized every year from RSV, and 14,000 fatalities in older adults each year. To prevent the spread of RSV, it's important to make sure to cover your coughs or sneezes with tissues or your elbow. Wash your hands or use hand sanitizer frequently. Avoid close contacts with infected people, and then clean potentially contaminated surfaces like counters, doorknobs, light switches, etc. So on this slide, we have a chart that compares all of these symptoms. So as I was going through those viruses, I'm sure you saw a lot of similar symptoms such as cough, shortness of breath, fever, feeling tired. So a lot of these symptoms are common among different respiratory viruses. So we made a chart that compares the symptoms, some of these common symptoms, and then looks at different scenarios, so like COVID-19, the common cold, flu, and allergies. And then this chart basically shows whether these symptoms of cough, shortness of breath, sneezing, runny, stuffy nose, sore throat, fever, feeling tired, headaches, body aches and pains, and diarrhea, whether that is common in these diseases or in the viruses or allergies. And the reason that we compare COVID, cold, the flu, and allergies is because a lot of these seasons, and when these when the peak of these seasons happens, they all happen around the same times. So really the main point of this slide is just, it's important to identify when you have changes in symptoms and to understand what that could be related to. So if you know that you're susceptible to seasonal allergies, if you have a runny or stuffy nose, it could be due to that. But if that's something that happens to you every year, then maybe it's not something that you have to worry about. But if it's something that is not common for you, if it's something that is not common to your normal, those types of changes in symptoms should be reported to a doctor and monitored to make sure that it doesn't progress into something more serious. So now we'll review some ways that you can protect yourself. So whether or not you're in those high-risk categories for getting the respiratory viruses, or if you have a respiratory disease, there are measures that you can take to keep yourself healthy and also protect the others around you. So the first and most important thing is to get your vaccines. Vaccines help to prevent disease and protect your immune system from developing severe illnesses from viruses. So first, if you haven't gotten your COVID-19 vaccine yet, it is important that you get it as soon as possible. With the rise of the Delta variant of COVID-19, we are seeing a rise in hospitalization and severe illness, particularly in those who are unvaccinated. Older adults and those with chronic diseases are particularly vulnerable because they are at more of a risk of developing a severe illness if they contract COVID-19. So the more people that are vaccinated, the less COVID-19 will spread and mutate into variants. So urge anyone you know who is not vaccinated to get vaccinated right away. You can call the Chicago Department of Public Health or visit its website to find vaccines near you. And in Chicago, the Department of Public Health is actually working to vaccinate people at home, so you don't even have to leave your house. So if you are interested in a homebound vaccine, feel free to call the number on the slide, which is 312-746-4835, or visit the Chicago Department of Public Health's website to schedule a homebound vaccination. So moving on, and especially during the COVID-19 pandemic, it is important to keep up to date with other necessary vaccines, and this includes your flu vaccine. So getting the flu can leave you more vulnerable to a harsher attack from COVID-19, and those who are already at risk for getting respiratory disease can face serious consequences. So it is important to make sure to get your annual flu vaccine. The other three vaccines listed on this slide are the shingles, meningitis, and pneumonia vaccines. So these are all recommended vaccines for older adults. So make sure to talk to your doctor to make sure that you are up to date on all of these necessary vaccinations. So besides vaccines, there are other prevention measures that you can take. Last year, we saw a dramatic decrease in flu cases due to social distancing and masking orders that were in place because of the COVID-19 pandemic. We actually saw a 98% decrease in flu cases. So this was due to, because people were social distancing and masking, and also frequently washing their hands, there was a dramatic reduction in the spread of infection. There was also a drop in emergency department visits for respiratory illnesses. So people who had COPD, asthma, and other respiratory infections were going to the emergency department less. So for those who are more at risk, it's a good idea to think about wearing your mask and participating in social distancing measures in times of high respiratory infections, like during flu season, or if you're living in an area that is experiencing higher rates of COVID-19. And then also during these times, it's a good idea, and it's always a good idea to frequently wash your hands and clean high-touch surfaces to prevent the spread of diseases from person to person and from surfaces. And then in general, it's important to create a plan for your household when someone is sick. So you want to figure out who would be the best person to take care of a sick person in your house, and what social distancing and masking measures you may need to set in your household. And if in the case that the caregiver of your home is sick, you want to make a plan to have a backup caregiver. And then also, if someone outside of your household is feeling sick and you have plans to meet up with them, it's okay to reschedule and set rules in your home to protect your lung health. So as I was saying earlier, it is important to know when there are changes in your symptoms or changes to your normal, so you know when to reach out to your doctor or healthcare team. So this is a tool that we use, or an example of something that we have in one of our resources for people living with COPD. So it's called My Day Reading. And we separate it into a green category, a yellow category, and a red category. So the green category is when you're feeling normal. So you have no extra effort to breathe, no extra effort to cough, sleep, eat, or do any physical activity. So in those cases, it has recommendations of what you should do. So that means taking your medicines as usual, continuing oxygen if you use it, exercise and eat normally, and then avoiding lung irritants and staying inside on bad air days. Then we have, we have a yellow zone. So this is when you're experiencing one or more symptoms. So including having more or thicker mucus, feeling more tired, feeling breathless, feeling like you have a cold, and feeling like medicine isn't helping. So in these cases, you should continue taking medicines, limit activities, practice pursed lip breathing or breathing very deeply, and then let your doctor or medical team know about these changes in your symptoms. And then finally, the feeling red category is if you are having a medical emergency. So this could be severe breathlessness, having blue lips or fingers, fever, feeling confused, chest pain, or coughing up blood. And then in these cases, you want to call 911 and have your caregiver or someone close to you call a doctor or healthcare team. So like I said, this is a tool that we have in one of our COPD resources. So it's a little bit more COPD focused, but the principles of this day rating can be applied to any other chronic conditions, or even if you don't have a chronic condition, any other type of situation. So you want to make sure to think about what a normal day feels like for you. So what is your green zone? And then what changes in your symptoms will make you feel uncomfortable, make you move to that yellow zone, versus what changes will make you feel like you're in the red zone or having a medical emergency. And for this, you can definitely work with your healthcare provider to identify what changes in symptoms are in those yellow or red zones. And then speaking of healthcare providers, we also have a list of tips to make the most of your doctor's appointment. The average visit with a healthcare provider is about 20 to 30 minutes. So you want to make sure that you have, you can make the most of your time with your healthcare provider. So the first step, you want to make sure that you prepare for your appointment. So bring a list of current medications and make a copy for your healthcare provider. You also want to prepare a list of questions to ask during the visit, and then provide results from other healthcare resources or other specialists that you may have seen. And then make sure to include a significant other or caregiver in preparing for the appointment. During your appointment, you want to make sure that you ask the most important questions first. And then work with your healthcare provider to create an action plan and manage conditions or episodes or any changes in symptoms. Make sure to take notes during your appointment, fully describe any symptoms, and then review any decisions and next steps at the end of the visit so you know what to do. And then after your appointment, it's important to maintain communication with your provider. And then if needed, you can get a second opinion from another provider. Some other things to consider is that most primary care physicians encourage the advice of a specialist. So if you have not created an action plan with your primary care, you can do so with a specialist. So another really important way to keep yourself healthy is to stop smoking if you are currently smoking. Stopping smoking can help slow the progression of COPD, no matter how long you have had it, and it can help with it can help decrease symptoms if you have other chronic lung diseases. Because smokers are also more susceptible to getting COVID-19, it's important to stop smoking and protect yourself. Quitting smoking can be challenging, but there are resources that can help you, including your healthcare provider, in-person programming, which I'll talk about a little bit more at the end. There's also the Illinois Tobacco Free Quit Line, which is a free resource where you can call, and there are tobacco cessation specialists ready to help you. But most importantly, it's important to think about quitting, because as you can see on this slide, quitting smoking has multiple health benefits, starting within minutes of quitting. Within 20 minutes of quitting smoking, your blood pressure and pulse drop to normal, and your hands and feet start to warm up. Within 24 hours, your chance of a heart attack decreases. So basically within a day of quitting smoking, the chance of getting a heart attack decreases. Within 2 weeks to 3 months after quitting smoking, there's improvements in circulation, improvements in lung function, and improvements in stamina. And then after a year, the risk of heart disease drops to that of half of a smoker. And then after 10 years, we see that lung cancer risk is half that of a smoker, that risk of cancers are a lot less, and that your body is just starting to repair itself. So there are multiple health gains when you quit smoking. So it is an important thing to consider if you are currently smoking. And so on this slide, we have some tips to consider if you are trying to quit smoking. So the first is to stay motivated. So you want to make a list of reasons to quit and keep that list where you can see it. So put it on your fridge, put it in your wallet, keep it on your phone. And then you can have these reasons ready to go and to revisit them whenever you have the urge to smoke. You also want to prepare your environment. So get rid of any reminders of smoking, such as supplies, and dispose of all of your cigarettes. Keeping around cigarettes or lighters just in case can undermine your self-confidence. You want to reward yourself for not smoking. So set short and long-term goals and reward yourself for each milestone that you reach. Making a contract with yourself or a friend can help you stay resolved. Get moving. So plan ways to stay active at home when a craving hits. You can find free workout videos online, do yoga, lunges, or push-ups in your home. So staying active can help keep your mind off of smoking until a craving passes. You want to make sure to find support. So have someone that you can call or reach out to when you have the urge to smoke. Share your decision to quit with someone else or people that are important to you, so they can help hold you accountable. And then finally, don't be discouraged. Many former smokers have tried to stop smoking several times before they finally succeed. So if you give into a craving, don't let it get you down. You want to examine what went wrong and learn from what happened, and then try to quit again. So finally, at RHA, we always want to add something for some information for caregivers as well. As we know that caregivers often spend a lot of time taking care of others, but don't necessarily take the time, or may not necessarily take the time to take care of themselves. So we like to emphasize that caregivers also need to maintain their own health and well-being too. As we know that caregiver burnout can happen. Some of the consequences of caregiver burnout include hopelessness, overwhelming anxiety, sleeping problems, and difficulty coping with everyday tasks. So it's important to ask for help, as caregiving can be stressful. You want to pull in other family members or friends to help once in a while, so that you can take some time for yourselves. It's also important to establish a backup caregiver and provide them with all the necessary health information when you're unable to perform your caregiving duties. You also want to use available resources. So there are caregiver support groups out there, and you want to make sure that you have an action plan to help keep track of appointments and treatments, which you can work with these support groups or work with resources to make an action plan. And then finally, at Respiratory Health Association, we have a toolkit for caregivers of people living with COPD, which I'll go over in a couple of slides. But if you are a caregiver of someone with a different chronic disease, check with other disease nonprofits to see what resources are available for caregivers. All right, so to wrap up, I am going to go over some of the resources that we have at Respiratory Health Association that can help with taking care of yourself and help protect you from respiratory viruses, or help you stay safe if you have a respiratory illness. So first, quit smoking. So it is important when you are quitting smoking to know that you're not alone. There are a ton of resources out there. Some of the resources that we have at Respiratory Health Association are some handouts. So as you can see, there's some examples on the side. We have brochures about quitting smoking, a poster of the health gains that you gain when you quit smoking, tear pads, posters, and little quit cards. So all of this just gives you information about quitting smoking, and it gives information about where you can find groups if you are interested in joining a group to help you quit smoking. If you aren't ready for a more intensive program, Respiratory Health Association has our Courage to Quit program. So this is a 3 or 7 week program that helps people quit smoking. We have trained leaders to lead in person or virtually. And so if you're interested, you can visit couragetoquit.org or call 312-229-6186 if you want to find and be connected to a current program. The second thing that we have, it's called Project Strength. So these are resources to do pulmonary rehab at home for people that are living with COPD. So there are 4 packets. The first one helps people living with COPD set goals to be healthier. It describes what changes in symptoms look like. So that was where we got that My Day rating graphic. And then it helps you to create a support team. The second packet, it's called Boost Your Lung Health. So this walks through oxygen therapy, how to manage your medications, nutrition, and quitting smoking. The third packet, Find Your Strength, has exercises that you can do safely at home, helps you make an exercise plan, and has an exercise tracker to keep you motivated and stay on your exercise plan. And then finally, Healthier at Home. It gives tips on how to save energy in daily activities and goes over breathing techniques and stretching. So we have electronic copies available for download at our website, resphealth.org/strength. And hard copies, we are able to send hard copies for free thanks to some grant funding from NHLBI's Learn More, Breathe Better program. So my contact information will be at the end of this slide. If you're interested in getting hard copies, you can feel free to reach out to me. We also have our COPD Caregivers Toolkit. So this is a resource that was designed for caregivers of people living with COPD. It's split into 5 sections that go over different aspects of a COPD caregiver's journey. So this includes how do I help the person I'm caring for manage COPD? What should I know about managing a home for someone living with COPD? How do I prepare for a visit to the doctor? How do I help after a COPD flare-up or hospital stay? And then how do I take care of myself while managing someone else's care? So each of these sections has worksheets, templates, and blank pages to fill in. And then in addition to providing information, it can act as a catch-all for all documents and handouts that you receive from other medical providers, because each section has some pockets where you can store documents or important information. So this is generally available for purchase. However, we are able to distribute it again for free through some funding that we've gotten for a study. So the study that we're doing is we're looking for caregivers of patients living with COPD just to use the toolkit for a year to see if it has an impact on their health and well-being. So as a part of the study, you get a copy of the toolkit for free, and then you just have to take a survey at the beginning and the end of the study. So again, if you're interested in receiving this toolkit or receiving more information about it, please feel free to contact me. And then finally, we have our website. So the Respiratory Health Association website has a ton of different resources. We have a lot of fact sheets, including current info on COVID-19, and we're constantly trying to stay updated with COVID-19 and come out with different resources for it. So please feel free to visit our website if you want current information about it. We do have electronic downloads of newsletters and resources. And then we also have a webinar series. We usually host a webinar every 2 months. So some of the topics that we've had in the past are about the COVID-19 vaccine, the changes in lung cancer screening, trends in women's lung health, school-based asthma policies, and then we have a COPD webinar series that usually comes out in November. So please visit resphealth.org if you'd like more information or like to access these resources. All right, so I think I will stop here for any questions.
Thank you so much. That was great. Really great tips and information. Thank you so much. And before I forget, could you share your information in case anyone is interested in getting the toolkit or getting more info?
Yeah, so here is the slide with my information, and my direct number is 312-229-6186.
Perfect, thank you. So we'll go ahead and keep that up. Wonderful, so we have a few questions already. What I'm gonna do is let's start with whoever has joined in over the phone. If you would like to ask a question, you can press *67 on your phone and ask now. All right, so we'll have one more opportunity for those of you on the phone if you want to ask a question. And again, to press *67 and then you can ask your question. All right, so first question. Is oxygen therapy the same as being on oxygen?
Yes, that is. So yeah, if you are currently on oxygen, you're undergoing some type of oxygen therapy. So that is something that your doctor decides how much oxygen you need and in what cases you need to use oxygen.
Okay, great. To that end, what is pulmonary rehab?
Yeah, so pulmonary rehab is it's generally an exercise program that is prescribed to people with lung disease, especially people that are living with COPD. So in general, it's usually prescribed after somebody with COPD goes to the hospital or has a COPD flare-up, and so their lungs become a lot weaker. And so to basically strengthen your lungs and strengthen your stamina, it's suggested that you go to pulmonary rehab 2 to 3 times a week, where you do some aerobic exercises. So that would be like doing some elliptical work or, walking laps on a track, and then some strength exercises. So, working on like upper body muscles and lower body muscles. And so it is actually, we actually have seen that anybody with COPD who does pulmonary rehab exercises, it actually helps to manage your COPD a lot better. So you have less flare-ups in the future, your lung health is a lot better. It just generally helps you to be more healthy. So those packets that we have, the at-home pulmonary rehab resources. So those can be used if you're not necessarily prescribed pulmonary rehab, or you can't get to a program and you want to kind of get started or see what it's like, you can see what exercises you can do at home to kind of get the ball rolling. And then also at pulmonary rehab, you learn about other ways to keep your lungs healthy. So, managing nutrition, how to manage your medication. So there's also an educational component to it as well.
Awesome. All right, we have 3 more questions online. The next question, do air purifiers in the home help fight respiratory issues?
I don't know if it helps to fight respiratory issues, but I think it definitely helps to keep the air clean. So I think for indoor air quality, one thing that you just want to think about is like if you have a chronic lung disease like asthma or COPD, dust, like air pollutants, even inside can cause flare-ups in your condition. So if you do, so an indoor, I guess the idea of an indoor air purifier is it gets some of those contaminants out of the air. So I think, yes, it helps with, I think it helps if you have a chronic disease. I don't think it necessarily helps with the spread of viruses, but if you do have a chronic lung disease, I think it's a good way to kind of keep your lungs healthy.
Great. All right. And our last question, what are ways to know that your symptoms are not just a regular cold and something to talk to your doctor about?
Yeah, so that chart is actually something I'm happy to share with you after the presentation. And it's definitely not, something that you should base your decisions off of. But I think if you are having, a regular cold, you're going to have changes in your health, but things that are not necessarily not preventing you from kind of going throughout your day-to-day activities. So you might like feel achy, feverish, sneezy, but you can kind of still walk around, move. I think when you think about it getting worse, you have to see how is your day-to-day activity being affected. So if you have a fever that is preventing you from doing day-to-day activities or even moving, maybe that's when you need to talk to your doctor. And again, I think this is also something, it depends on person to person. So if you have a chronic lung disease, your symptoms are going to be different than if you don't have a chronic lung disease. So this is where it is important to kind of talk to your healthcare provider and see, take that day rating thing with them. Like ask them, what are my green symptoms? So like if I have a chronic lung disease, I might have some difficulty walking outside when it's very humid, because humidity can affect that, but it doesn't necessarily mean I'm feeling yellow or feeling red. So that's a long way of saying I think you should probably talk to your doctor to see what the difference is between for symptoms of a cold would be versus having COVID or the flu or another severe respiratory infection. But I think it's just you need to monitor what your daily activities are and how if you can perform them, you're probably okay. But if you can't, that's maybe when you need to start talking to your doctor.
Wonderful, thank you. And one more opportunity for those of you who've joined in over the phone. If you want to ask a question, you can press *67 now. All right, it looks like you got all of them. Thank you so much again. Thank you for being our speaker. For all of our participants, if you wanted more information, if you wanted a copy of the toolkits, or you want to get in touch, you can call 312-229-6186. All right, so we're going to go ahead and share some of our upcoming programs. All right, there we go. Okay, So first we have Take Charge of Your Health. This is a workshop that's all about learning how to manage your chronic conditions. This will be on Mondays from August 23rd until October 11th from 2 to 4:30 p.m. The workshop will be taking place entirely on Zoom. So that is being done virtually on the computer. Now, if you're interested in Take Charge of Your Health, but you're not sure how to use Zoom yet, that's okay. You can still call to register, and a member of our team can help you figure out those issues and get comfortable before the first day of the workshop. Next, we have our Walk with Ease program. This will be on Wednesdays, Thursdays, and Fridays from September 8th until October 15th. This is from 10 a.m. until 11:30 a.m. And this program is all about getting outside, connecting with people, and walking and being more active. This one will actually be taking place at the Garfield Park Conservatory. If you're interested in this program or learning more, you can call Rush Generations at 800-757-0202. So for this program and all the programs I'm about to share, you can call the Rush Generations number. Next, we have our Mindfulness 101 workshop. A really great opportunity, typically fills up pretty fast. This one will be on Thursdays from September 9th until October 7th from 1 to 2:30 p.m. Again, this will also be taking place through Zoom, so online, and you can call Rush Generations to register to get more information. Again, Mindfulness 101, Thursdays, September 9th till October 7th, and you can call 800-757-0202. Next, we have WRAP for Seniors. So that's WRAP, the Wellness Recovery Action Plan. So this is a really great opportunity to be in a group and to learn about how to manage stress and the day-to-day stresses of daily living and how to cope with that. It's a really wonderful opportunity for everyone. And so this will be on Wednesdays from October 6th until November 10th, 10:30 in the morning until noon. Again, October 6th to November 10th, and this will also be taking place through Zoom. We also have our Coping and Connection in the Time of COVID support group. So this is a wonderful opportunity. It started pretty much at the onset of learning about COVID and everyone starting their stay-at-home order. And it takes place the third Wednesday of every month. It's a conference call, so it's over the phone. You can just dial the number the third Wednesday of every month at 3 p.m. and there's a social worker on the line. And so you'll be able to speak with a group of people and share your concerns and stresses about COVID and what you're finding to help. Again, a really wonderful program. And to get the phone number and the access code, you can also call our Rush Generations number. Again, 800-757-0202. We also have the Diabetes Education and Support Group. This is the third Thursday of every month from 2 to 3 p.m. Again, for the phone number and the access code, you can call Rush Generations at 800-757-0202. Next, we have our Senior Connections Friendly Caller program. So if you're feeling lonely and you would like to receive a call from a volunteer once a week, this is a really great opportunity for you. So by starting this program, you'll get to share what days work best for you, and then your volunteer will call you on that day just for friendly conversation. So if you're interested, you can call 800-757-0202. All right. And our speaker did such a wonderful job talking about the needs of caregivers. And so this is a really great opportunity for you as well, the Rush Caregiver Initiative. So this is education and support for family caregivers of individuals 65 and older. So if you're caring for someone who's 65 and older, the way that it works is you would call the Rush Caregiver Initiative, which is 312-563-0350, and they'll do an assessment and then come up with a personal approach to what works best for you. So it's a really wonderful way to take care of yourself, whether you're a caregiver or if you have a caregiver, a really great program to consider. All right, and last but not least, we have our Shaman Senior Voices program. So Shaman Senior Voices is all about learning what matters most to you as you age. So if you go to the Shaman Senior Voices website, which is aging.rush.edu/shaman, you can view a number of videos that we've collected in the community of older adults sharing what matters most to them. We also have videos from students sharing why it's important to learn what matters to older adults and how that leads to better care. So really, your voice is so important, and we want to hear from you. And so if you wanted to record a video answering that question of what matters most to you as you age, you can visit bit.ly/recordmystory and record a video. And recording a video basically means that those videos would come to our team and we would be able to learn what matters most to older adults. And then we use that information to design future programs, to educate our healthcare students, to educate our healthcare professionals, and to have these conversations around aging that we don't have nearly enough. Also, if you're just interested in the program and you want to learn more, you can also call the Rush Generations number. All right, and just a final reminder that Rush Generations is here with you during this time of staying at home and staying safe. So we have a number of great programs to be involved in, and to learn more about them or to register, you can call 800-757-0202. There's also a Rush Generations Facebook page. So if you like to go on Facebook, you can check that out as well, where we post frequently about upcoming programs and events as well. So just one final thank you. Thank you so much for being our speaker today. A really great presentation. And thank you so much to our participants for joining.
Yeah, thank you for having me.
Thank you.